Okay, all members, please come to the floor. We'll bring this meeting back to order. Mr. Clerk, will you read the caption to House Bill 951?
House Bill 951 by Representative Clark of the 100th to be entitled an act to amend Chapter 24, Title 33 of the Official Code of Georgia Annotated relating to insurance generally so as to require health benefit plans, policies, or contracts executed by the state to cover medically necessary orthotic devices and prosthetic devices and their materials and components. This bill having referred to the Committee on Health, that committee recommends that this bill do pass.
You ready? Stays ready. Representative David Clark is recognized to present House Bill 951. Gentleman's recognized. Please give the gentleman your well. This is a pretty cool bill, y'all. Give the gentleman your well your attention, please.
Thank you, Mr. Speaker. I'm bringing before you House Bill 951. And last year we passed legislation which required commercial insurance plans to provide coverage for medically necessary prosthetic and orthotic devices. And that legislation was signed into law by Governor Brian Kemp. However, the state health care plan was not included, meaning employees under the state health benefit plan and the Board of Regents system do not have the same protections. And so this bill just simply brings parity across the state, so state employees, university employees, and teachers are treated the same as those on commercial plans. And it also just promotes responsible health care policy because mobility and proper prosthetic care often prevents more expensive medical complications later. So I'll answer any questions, but it's just going along with the bill from last year and it's adding the state health care plan and the Board of Regents.
You have one bill. Representative Park Cannon to your left is recognized for a question.
Thank you, Mr. Speaker. Do you yield?
I yield.
What kind of prosthetic devices would this bill cover?
So this covers orthotics, prosthetic devices if the physician recommends it. And so, I mean, whatever they need. So whether, because usually, and we talked last year, you usually only got one every 5 years. Now it's allowing a total of 3 because a lot of times the standard one you get, you can't go take a shower, you can't go work out, doing other basic things. So this is just allowing, based on that doctor and the patient, to talk about what's best for them to just live a normal life.
Thank you. Do you further yield?
I yield.
And so you mentioned prosthetic devices, perhaps to be able to go to the shower. So maybe that means having to ambulate or walk, like a leg prosthetic. Is that correct?
Yes.
Okay. Do you further yield for one final?
I do.
Okay. And so many of us have become aware of Mr. Rodney Taylor, who's currently incarcerated here in Georgia seeking prosthetic devices to get to the shower. Would this support him, or is this only for state employees? Thank you.
This is, last year we did commercial plans. This is adding the Board of Regents and state health care plan.
You have one more. Yes, Chair Lady Katie Dempsey is recognized for a question.
Does the gentleman lead? Yield. I'm sorry. You always lead. I'm sorry. It's getting late and tired, aren't we? No, I just want to thank you for this measure. Actually, I believe someone came from Rome to speak in the committee, Hannah Neighbors, a true champion and advocate not only for herself but for others. And she was a victim of such a surprising and dreadful accident and has just stood forward not only for this, but for all kinds of people who struggle in the world that might be considered people with disabilities. So thank you for giving ability to those.
Definitely. Thank you. With that, I yield the well and ask for your favorable consideration of House Bill 951. Thank you.
Thank you for bringing the bill. The gentleman's yielded the well. Is there any objection to the previous question being ordered? Hearing none, the previous question is ordered. Is there any objection to agreeing to the report of the committee, which was favorable to the passage of the bill? Hearing none, the report of the committee is agreed to. Shall this bill now pass? All in favor of the passage of the bill will vote yes. All those opposed will vote no. And Mr. Clerk will unlock the machine. Have all members voted? I got you. Take a minute. All members voted. If so, Mr. Clerk will lock the machine. On the passage of House Bill 951, the yeas are 163, the nays are 2. This bill, having received the requisite constitutional majority, is therefore passed. Mr. Clerk, will you read the caption of House Bill 641?
House Bill 641 by Representative Lim of the 98th and others to be entitled an act to amend Chapter 3, Title 46 of the Official Code of Georgia annotated relating to electric services so as to require that an electric supplier hold the proposed discontinuation of electrical service to a residential consumer who suffers from a serious illness in abeyance for a certain period of time. This bill having been referred to the Committee on Energy, Utilities, and Telecommunications. That committee recommends that this bill do pass by committee substitute.
Thank you, Mr. Clerk. Representative Marvin Lim is recognized to present House Bill 641. Gentleman is recognized.
Thank you, Mr. Speaker. Good evening, colleagues. All right, let's start over. Thank you, Mr. Speaker. I am honored to present House Bill 641. This bill simply states that electric utility suppliers have some written policy regarding disconnections for those residential consumers with serious life-threatening conditions that could be aggravated by that disconnection, and will furnish that policy to consumers upon request. I want to thank those who have told of their experiences in support of this bill. Above all, one Miss Tina Marsden, who's watching from Griffin. She has a left ventricular assist device, or LVAD, and has deftly told her story regarding the importance of this legislation, given the disconnections she experienced despite being able to make payments. I also want to thank the American Heart Association as well as Representative Mathiak for their advocacy. To be clear, Georgia Power, which already has a policy per Public Service Commission rules, as well as Georgia EMC and the Electric Cities of Georgia, are each and all in support of this legislation, and I thank them all not only for coming to the table, but also for their commitment to work with us to ensure that each supplier develop the best version of a policy that works for them and their localities. I ask for your support on this legislation, and I am happy to yield for questions if there are any.
Representative Rhonda Taylor is recognized for a question.
Thank you,
To
Mr.
your
Speaker.
left.
Does the gentleman yield?
I do.
While this bill, I understand the effort and I appreciate the effort. What happens when the bill increases, the total amount gets to be insurmountable for that individual? Is there something in this bill that allows them to not have to come up with all of the money, the balance at one time?
There is not. That is left to the discretion of the individual supplier. However, we feel strongly that by having that policy, most suppliers are quite ready to be able to refer people not only to payment plans within that supplier, but also to programs like LIHEAP, the Low Income Housing Energy Assistance Program. And so while it does not directly address that, it certainly facilitates those conversations. And I've had many experiences with my own constituents working with my EMC as well as Georgia Power to facilitate exactly that.
Thank you for the question, for the answer.
Thank you, Representative Taylor.
Representative Park Cannon, she has a question. Ladies recognized.
Thank you, Mr. Speaker. Do you yield?
I do.
So does this help people with serious medical conditions to charge their medical equipment, to refrigerate their medicines? Can you just tell us a little bit more?
Exactly that, and Miss Marsden's experience is a perfect example of that. She was disconnected despite having the LVAD, which very much relies on electricity to be able to charge it and keep it running. And of course, there are other conditions that are quite serious that specifically require that electricity, including the refrigeration example you mentioned. So yes, absolutely, in those cases, this would assist.
Thank you. Do you further yield?
I do.
Thank you so much. And so would you say that this is a preventative measure for our growing healthcare costs in Georgia, that this would be something that could actually prevent people from fatalities or having to go to the emergency room, things of such?
Absolutely. We know that an ounce of prevention is worth a pound of cure, as my mom always states. And so if we can prevent people's already serious conditions from becoming not only fatal, but worsening, even if it's not fatal, not only will we preserve their lives and their dignity, but also lower healthcare costs, both for them as well as for our healthcare system as a whole.
Gentleman, yield for one more.
I do.
Representative Lauren McDonald is recognized for a question.
Does the gentleman yield?
I do.
Do you have a list of all these illnesses, or is mental health included in this as an illness that would qualify for this?
That's a great question, and we did discuss that in committee. There are general definitions within the code as to what consists a serious condition, but ultimately in the amended version, or rather in the substitute version, we felt that with respect to the PSC rules that already exist, that system was working well enough for that supplier, in that case Georgia Power, to be able to define that, and two, that we still wanted to leave it with some discretion, depending on the size of the utility, for example, to be able to state what does and does not qualify. As we discovered in committee, not one policy will fit every single person, so that is intentionally by discretion.
The gentleman has no further questions.
Thank you, Mr. Speaker, and again, I ask for your support.
Thanks for the work on the bill. Is there any objection to the previous question being ordered? Hearing none, the previous question is ordered. Is there any objection to adopting the committee substitute? Hearing none, the committee substitute is adopted. Is there any objection agreeing to the report of the committee, which was favorable to the passage of the bill? Hearing none, the report of the committee is agreed to. Shall this bill now pass? All in favor of the passage of the bill will vote yes. All those opposed will vote no. And Mr. Clerk will unlock the machine. Have all members voted? All members voted? If so, Mr. Clerk will lock the machine. On the passage of House Bill 641, the yeas are 134, the nays are 28. This bill, having received the requisite constitutional majority, is therefore passed. Mr. Clerk, will you read the caption to House Bill 668?
House Bill 668 by Representative Thomas, the 21st, and others to be entitled an act to amend Title 16, Chapter 4, and Title 30, and Chapter 6 and Title 40 of the Official Code of Georgia annotated relating to crimes and offenses, rights of persons with disabilities, and uniform rules of the road, respectively, so as to change reference to assistance and guide dogs to service dogs. This bill having referred to the Committee on Public and Community Health. That committee recommends that this bill do pass by committee substitute.
Representative Brad Thomas is recognized to present House Bill 668. The gentleman will suspend for a second. The gentleman's recognized.
Thank you, Mr. Speaker, members of the House. I rise today to present House Bill 668, a bill that, at its core, is about one thing: keeping faith with Georgians who depend on service dogs to live full, independent lives. This legislation does several important things by modernizing our law and protecting the dogs that protect our most valuable citizens. Right now, Georgia statute uses a patchwork of terms, guide dog and assistant dog, spread throughout our criminal code and our disability rights code. The Americans with Disabilities Act, the federal law, uses one term: service animal. HB 668 brings Georgia statutes into alignment by adopting a single, clear, unified term: service dog. When a police officer responds to an incident, when a prosecutor builds a case, when a business tries to determine legal obligations, clarity in the law saves time, prevents errors, and protects rights. This bill creates one term, consistent across Titles 16, 30, 40. And I believe that's good legislating. For a veteran who has PTSD, a service dog is a lifeline. For a child with epilepsy, a service dog is an early warning system. A Georgian who is blind or deaf, service dogs are their eyes and ears. These animals are precisely trained, often for 2 or more years, at costs exceeding $25,000 per dog. They're working animals, and their role is irreplaceable. Yet Georgia current law, if someone intentionally kills or harms a service dog, the legal remedy is largely limited to property damage statutes. I believe we can all agree a service dog is not a piece of property, and harming one is not like smashing a windshield. HB 668 creates specific criminal offense for intentionally and knowingly causing the death of a physical harm to a service dog. In closing, my fellow members, HB 668 is about a veteran who depends on his dog to get through the day. It's about a child whose dog can't detect seizures before it happens. And it's about making sure that when Georgians play by the rules, the law backs them up. This bill passed committee with strong support. I've worked on a personal note, I've worked on this bill for 5 years. There's a young lady that's up in the gallery. Her name is Casey Nicole Whitworth, and she has worked with me for 5 years to get this bill here to this day. If everybody could please recognize her. And with that, Mr. Speaker, I'll take one question. With that, Mr. Speaker, I'll yield for one question out of respect for the time for my fellow members.
Well, I have one, but I'll let Representative Seabaugh take my time. I'll yield to him. The gentleman is recognized for a question.
Thank you, Mr. Speaker. Does the gentleman yield?
I do.
Is it not true that these animals are life-changing for their handlers and just simply amazing animals all around?
They are, and they make a huge difference for the people that rely on them on their everyday lives. Oh, and by the way, her dog's name is Karma. With that, Mr. Speaker, I yield the well.
Gentleman's yielded the will. We do have a speaker, Representative Park Canada, has signed up to speak in favor of the bill. Lady has about 5 minutes.
Thank you, Mr. Speaker. I am so incredibly thrilled that this bill has made it to the floor, and just wanted to add some context to what we're really working on right now. Of course, we understand that there should be crimes for falsely claiming a service dog, but there should also be protections for individuals who actually need these service dogs. And so, what are some of the benefits of having a service dog? Well, they can greatly improve the quality of life for individuals with either mental or physical disabilities. And there are a lot of factors to be considered here. One of those could be mobility assistance for individuals who have limited mobilities, people who use wheelchairs, or people who need help ambulating. This, of course, can help them to open doors. This can help them to press buttons, help them to turn light switches on and light switches off. And in real time, sometimes when items are out of reach, they can help them to get to them. This bill expands the definition of individuals who can utilize service dogs, and it actually moves beyond some of the areas that we used to include and makes it so that it's not only those who are physically disabled and blind or deaf, but actually secures rights for other accommodations. Did you know that service dogs can also help detect allergies? Many of you know that the pollen season is among us here in Georgia, and not only are there external allergies, but there are, of course, food allergies, and sometimes these food allergies or insect allergies can really wreak havoc and be potentially life-threatening for individuals. So when dogs are specially trained to be able to detect those allergies, it can be super helpful. As many of us know, we have pets at home. I have 2 small dogs at home. They are not trained service animals, but they certainly provide some level of mental health support. You know, specifically service dogs actually can help with post-traumatic stress disorder, schizophrenia, depression, anxiety, and bipolar disorder. And for many of those individuals who could otherwise have self-injurious behavior, this could help them to move past it. As we close out and thinking about this important piece of legislation, I too want to thank Casey for the work that you have done. It's always a pleasure to see you in the community. As a member of the LGBTQ community, seeing you sometimes is really just a perk. And of course, you come with a really cute and wonderfully working dog too. Thank you, Mr. Speaker. I encourage you to vote yes on this bill, and I yield the well.
Ladies yielded the well. That completes our comments on House Bill 668. Is there any objection to the previous question being ordered? Hearing none, the previous question is ordered. Is there any objection to adopting the committee's substitute? Hearing none, the committee's substitute is adopted. Is there any objection to agreeing to the report of the committee, which was favorable to the passage of the bill? Hearing none, the report of the committee is agreed to. Shall this bill now pass? All in favor of the passage of the bill will vote yes. All those opposed will vote no. And Mr. Clerk will unlock the machine. Have all members voted? All members voted. All members have voted. All right, get to it. Burning daylight. Oh, no, we've already burned all the daylight. There you go. All members have voted. Mr. Clerk will lock the machine. On the passage of House Bill 668, the yeas are 168, the nays are 0. This bill, having received the requisite constitutional majority, is therefore passed. Thank you. Thank you, Representative Thomas. Mr. Clerk, will you read the caption to House Bill 1166, 1166?
House Bill 1166 by Representative Oliver, the 84th, and others to be entitled an act to amend Chapter 66 and Title 36 of the Official Code of Georgia annotated relating zoning procedures as to pertaining to counties and municipal corporations, so as to provide that zoning decisions shall not affect or be required for certain residential dwellings of 400 square feet or fewer. This bill having referred to the Committee on Governmental Affairs, that committee recommends that this bill do pass by committee substitute.
Representative Tangi Herring is recognized to speak to the bill. Representative Herring.
Thank you, Mr. Speaker and members of the House.
Gentlelady will suspend for a moment.
Thank you, Mr. Speaker and members of the House. House Bill 1166 is about families. It allows parents, grandparents, and adult children to stay together on the same property when life circumstances hit. The bill simply says that on residential property, a homeowner may build one secondary dwelling of 400 square feet or less without going through a zoning decision. That small space could provide housing for a grandmother who is no longer able to live on her own, an adult child getting back on their feet, or a caregiver who needs to live nearby. It also creates creative housing options for our workforce. That small unit can be rented to a first-year teacher just starting a career, a first responder who is serving our community, or another essential worker who may not yet be able to afford a home or an apartment. I was happy to work with the committee and other stakeholders to ensure that this bill works for all parties involved. This legislation is also about strengthening property rights, economic opportunity, and it allows homeowners to responsibly use their property to generate supplemental income, support seniors on a fixed income, and help families build generational stability while expanding housing options for teachers, nurses, first responders, and service workers. Importantly, this bill maintains safeguards. Local governments will still control building codes, septic systems, floor plan protections, and other health and safety regulations. And it is limited to one secondary unit per parcel. Members, this is a market-driven solution that expands opportunity without raising taxes or requiring new government spending. I respectfully ask for your favorable vote, and I will be happy, Mr. Speaker, to take 2 questions out of respect for time because I know there is a speaker to the bill.
There is a speaker, Representative Flanoy. To your left.
Thank you, Mr. Speaker. Will the gentlelady yield?
I will to my dear friend.
So just for a greater understanding, with our aging population, would this bill allow for another alternative for those families that instead of placing their loved ones in assisted living, could just have them on their premises with them?
Yes, it does.
Thank you for the bill.
Representative Washburn is recognized for a question.
Thank you, Mr. Speaker. Will the gentlelady yield for a question?
Yes, I will for my Macon night.
Is it not true that this suggestion for this type of ADU unit has been being suggested now for several years to address our housing shortage and housing crisis?
Yes, it is. Thank you.
Thank you so much for bringing this bill.
Thank you, Mr. Speaker, and with that, I will yield the well.
Ladies yielded the well. She had a couple more questions, but I want to hear from Representative Mary Margaret Oliver. That's what I came for tonight. I've been missing her in the well. Representative Oliver is recognized.
Thank you, Mr. Speaker. I'm very happy to join with Representative Herring in support of this bill. We had an excellent opportunity to discuss this issue in a wide variety of ways at Government Affairs. I thank the chairman for this opportunity. It's the first time, really, we had a very detailed and specific discussion from GMA and from home builders and from the realtors. Whether you're a small, medium, or large county, we know we need more housing options. And in many different ways, other housing options need to be brought forward to this body with all our diversity of ideas and participation in housing options for us to discuss this issue. I'm very grateful that we have an opportunity to move this issue forward. Thank you very much. A group of us have been working on housing options, tenant rights enhancements, and other incentives to create more doors, more opportunity for housing options that could be more affordable, like small houses less than 400 square feet. Thank you, Mr. Speaker, for allowing this bill to come forward. And for all of you, I ask for your favorable support. And when this issue comes to your community, which it will, this bill will give you additional options. Thank you, Mr. Speaker.
Thank you for your advocacy for this bill. It's a good proposition. That completes our discussion on House Bill 1116. Is there any objection to the previous question being ordered? Hearing none, the previous question is ordered. Is there any objection to adopting the committee substitute? Hearing none, the committee substitute is adopted. Is there any objection to agreeing to the report of the committee, which was favorable to the passage of the bill? Hearing none, the report of the committee is agreed to. Shall this bill now pass? All in favor of the passage of the bill will vote yes. All those opposed will vote no. And Mr. Clerk will unlock the machine. Have all members voted? All members voted. If so, Mr. Clerk will lock the machine. On the passage of House Bill 1166, the yeas are 111, the nays are 50. This bill, having received the requisite constitutional majority, is therefore passed. Mr. Clerk, will you read the caption of House Bill 421?
House Bill 421 by Representative Taylor, the 173rd, and others being entitled an act to amend Title 16 of the Official Code of Georgia annotated relating to crimes and offenses so as to establish the offense of traveling to meet a minor for indecent purposes. This bill having referred to the Committee on Judiciary and Non-Civil, that committee recommends that this bill do pass by committee substitute.
Lady will suspend just for a moment or two. Let's make sure the members can hear the presentation. Lady will proceed.
Thank you, Mr. Speaker. Member of the House, this evening I bring you House Bill 421, LC 481780S. This bill amends Code Section 16-6-5 relating to enticing a child for indecent purposes. This bill has been in the works for several years. In fact, our beloved Chairlady Mandy Ballinger co-signed and dedicated time to get this bill passed. I'd like to thank the Judiciary Non-Civil Chairman and the committee for their help in perfecting this bill. It came to my attention several years ago by a detective who worked the case. It is the result of an unfortunate incident. A predator from another state contacted a young teenager on the internet. They communicated for several weeks. Then the man came to town, went to the teenager's home, where he proceeded to make advances to the teenager. The father responded to some unusual noises and found the man in the boy's bedroom. Though his intentions were obvious, no act had been committed. Law enforcement came, and the man was arrested and charged. But we discovered Georgia had no law for traveling from another state. Our neighboring states, like Florida and Alabama, do. The judge dismissed the charges, and the man was let go. He went on to commit the same crime in other states. The detective who worked this case is now our sheriff and has actually testified about this man in other states. To correct this matter, the bill adds in Section 1, a person commits the offense of enticing a child for indecent purposes when he or she solicits, entices, or takes any child under the age of 16 to any place whatsoever, and we are adding, or travels from another state for the purposes of child molestation or indecent acts. Mr. Speaker, members of the House, this is a very simple one-page bill, but it fixes a very serious issue. It will help to protect our children from sexual predators. If there are no questions, I'll ask for your favorable consideration for House Bill 421.
Gentlelady has one question. Representative Carmen Rice to your left.
Thank you, Mr. Speaker. Does the gentlelady yield?
Yes, I do.
Thank you very much for carrying this bill. Does House Bill 421 not ensure that predators that come to Georgia can be prosecuted for harming our children?
Yes, thank you.
Thank you.
That's exactly what it does. Thank you, Mr. Speaker.
Representative Westbrook to your right towards the back is recognized for a question.
Thank you, Mr. Speaker. Does the gentlelady yield?
Yes, I do.
Will the Romeo and Juliet exception in OCGA section 16-6-4B2 apply? So in other words, a 15-year-old and a 13-year-old across state lines?
This does not touch any other part of the legislation. It affects just here. That's all it does.
Thank you very much. Thank you, Mr. Speaker.
Lady has no further questions.
Thank you. I appreciate your favorable consideration.
Ladies yielded well. Is there any objection to the previous question being ordered? Hearing none, the previous question is ordered. Is there any objection to adopting the committee substitute? Hearing none, the committee substitute is adopted. Is there any objection to agreeing to the report of the committee, which was favorable to the passage of the bill? Hearing none, the report of the committee is agreed to. Shall this bill now pass? All in favor of the passage of the bill will vote yes. All those opposed will vote no. And Mr. Clerk will unlock the machine. Have all members voted? All members voted. If so, Mr. Clerk will lock the machine. On the passage of House Bill 421, the yeas are 164, the nays are 0. This bill, having received the requisite constitutional majority, is therefore passed. All right. Mr. Clerk, will you read the caption of House Bill 382?
House Bill 382 by Representative Stevens, the 164th and others to be entitled an act to amend Code Section 161325 of the Official Code of Georgia annotated relating to Schedule I controlled substances so as to revise a provision relating to psilocybin. This bill having referred to the Committee on Health, that committee recommends that this bill do pass by committee substitute.
Chairman Stevens is recognized to present House Bill 382.
Thank you, Mr. Speaker. Ladies and gentlemen of the House, House Bill 382 is essentially the addition of 2 drugs that have not been released yet. Some of you may remember a couple of days ago we did the annual drug update bill.
Gentlemen, will suspend just for a moment. He's using some technical terms here. Y'all need to be paying attention. Proceed.
This is one of those cases where eventually something really good comes out of perseverance, even though you're told no time after time. If you'll look on Section 2 of the bill, it talks about lysergic acid, diethylamide, and also in Section 3 talking about psilocybin. Both of those drugs are Class 1 narcotic drugs. They have no medical use, highly addictive. But ladies and gentlemen, we had some research going on over the past few years from our very own Emory University. We've got both of these drugs about to be released, but they cannot be, of course, put on the drug update list prospectively. The first one you see here is going to be a drug that hasn't been the newest drug to come in for this particular disease, post-traumatic stress syndrome, has been maybe a couple of decades. The second one there, psilocybin, is going to be used to treat life-threatening, severe type depression. Both of these drugs, thank goodness the Drugs and Narcotic Agency, the Board of Pharmacy, worked with these pharmaceutical companies to work out a way so that the minute these drugs become approved by the FDA, the patients that need them so desperately will be available to them. In addition, there's a couple of things in there with pharmacy technician supervision, but I truly hope that you'll vote for this bill, and let's send some hope to these families and folks that have suffered from PTSD, maybe as far back as the Vietnam War. The time has come, and if you'll vote for this bill, you'll be a hero to a lot of these folks. Mr. Speaker, I'll take any questions if there are any.
Chairman Tarvin, to your right in the back, is recognized for a question.
Gentleman Yield,
Yes, sir.
is it not true that there's research that shows that this is a very effective drug
Yes,
for our
sir.
military guys, and it's almost like self-healing when they get into a mindset that they don't have the fears, and it clears their mind, and it's been proven to be a very good drug.
The gentleman's correct, and I watched one of my good friends.
I thank you very much for bringing this bill. I think it's very important.
Thank you, Mr. Representative. I watched my good friend that sat right over there for a whole lot of years that suffered with this disease, and thank goodness there's hope with this vote.
Chairman Bonner, to your right, is recognized for a question.
I yield.
Thank you. Does the gentleman yield?
Yes, sir, I yield.
Is it not true that this is an issue you've been working on for a number of years now, and each time that you've asked how this can best help our veteran community and access to these medications is going to help our brave men and women who suffer from these traumatic conditions?
Thank you so much, Representative, and I am extremely honored to bring this forth to this body that can help some folks that need it. Thank you. Mr. Speaker, I'll yield the well.
Chairman Stevens, thanks for your persistence in getting this done. I think it's going to make a big change, opportunity for a lot of people to get well. Is there any objection to the previous question being ordered? The chair hears none. The previous question is ordered. Is there any objection to adopting the committee substitute? Hearing none, the committee substitute is adopted. Is there any objection to agreeing to the report of the committee, which was favorable to the passage of the bill? Hearing none, the report of the committee is agreed to. Shall this bill now pass? All in favor of the passage of the bill will vote yes. All those opposed will vote no. And Mr. Clerk will unlock the machine. All members voted? All members voted. Chairman Blackman, you want to vote? All members voted. If so, Mr. Clerk will lock the machine. On the passage of House Bill 382, the yeas are 167, the nays are 0. This bill having received the requisite constitutional majority is therefore passed. Mr. Clerk, will you read the caption to House Bill 1116?
House Bill 1116 by Representative Blackman in the 146th to be entitled an act to amend chapters 5 and 8 of Title 48 of the Official Code of Georgia annotated relating to ad valorem taxation of property and sales and use taxes, respectively, so as to provide for the acceptance of tax digest in the event of a publication error made by a newspaper. This bill having referred to the Committee on Ways and Means, that committee recommends that this bill do pass by Rules Committee substitute.
We're going to stand at these just for a minute and let the paperwork catch up with our pace. Y'all making a good pace. Thank you for that. Let's take a break. Take a deep breath. Go get a Coke. A cup of coffee. Chairman of Rules. I'm running out of material, Mr. Chairman. How about if we stand at these and let you go put another little supplemental rules calendar on? Would you be up for that? Why don't you tell them what you're going to do?
If you would, please, would the members of the Rules Committee meet me over in 341 right now?
Temporary pause. All Rules Committee members over to your haven.